The impact of Cyclone Kenneth in Mozambique was quite devastating. A number of lives were lost, houses destroyed, livelihood in terms of crops were also destroyed, and a number of facilities were completely shattered in terms of structure. Yeah, children tend to face a number of health risks in post-cyclone situation. For example, Cyclone Kenneth, it resulted to a number of things, water-related issues like disruption of sewage system, disruption of water supply systems, or even the two systems getting mixed up, finally getting contaminated water or unclean water to the population, and that has resulted to a cholera outbreak that we are responding at the moment. Number two, we have in regards to floods, there's always stagnant pools of water lying around, which creating a conducive environment for mosquito breeding. And that has been attributed to the current increase of malaria cases in the population. As we speak, we are also staring at a malaria outbreak if quick response is not done. The cholera situation in northern Mozambique, as it stands at the moment, is that we have mapped 8 to 10 hotspots in the district of Pemba. We have a number of 4 to 5 sites reporting hotspots out of Pemba city. In that regard, we've had 109 cumulative cases to date that have been reported. 91% of those cases come from the city of Pemba. And among the reporting facilities is where we are standing now and where we are trying to set up a cholera treatment unit. Yeah, cholera can be a very dangerous disease for a number of reasons. One, you just lose your water through profuse vomiting or profuse diarrhea. You get into shock, and that translates literally to your body systems giving up, and due to severe dehydration, you lose your life easily. But the other side of things, that if you are able to access oral rehydration point or a cholera treatment unit behind me, you could be able to save life immediately without a great loss of life in the community. Children, the entire population are quite vulnerable to cholera for a number of good reasons. One, in such kind of situation whereby we are post-cyclone and there are water lying everywhere, these kids tend to access unsafe, not clean water. And once they ingest this water or they take this water, they succumb to the disease. That's one. Kids' immunity can also be compromised by the nutrition levels. The situation now we are facing in Cabo Delgado, there are a number of reported malnutrition cases, and with such kind of situation and with a cholera attack, that could be quite devastating to a child. And children can be so vulnerable to dehydration, any level of dehydration, and with a cholera attack, they might literally go fast to a severe degree of dehydration, and that could result to shock and death if not managed accordingly. The cholera treatment unit that currently you see behind has been established by Emergency Health Unit. In this unit, we are going to run a bed capacity of 10 beds. It will be purely focused on managing suspected cholera cases. In this place, we will be trying to stabilize patients. A cholera treatment center is a life-saving facility because this is where we tend to receive first patients that are suspected of cholera. They get first level of rehydration before being transferred to a bigger version of a CTU, which is a cholera treatment center at the other side. In such kind of a facility where we are standing, this cholera treatment unit supports the bigger hospital to do triage and improve the infection prevention control. Save the Children, through the Emergency Health Unit, has mapped a number of oral rehydration points in these oral rehydration points, we are able to manage moderate levels of dehydration, and that means that we are able to provide fluids at that level. And in case of severity, and if we are not able to manage them at that level, they are basically transferred to the cholera treatment unit behind us for re-evaluation, stabilization, rehydration, and possibly, if they are not able to be managed at this location, we are good to take them to the cholera treatment center, where you could be able to get advanced services.